2, human resource update.
Sure. Thank you, Mr. Chair. Just to update on where we're at with staffing and personnel from last month's update. We are currently still looking for 3 police officers. We have 1 administrative individual starting June 16th, so that position has been filled. The position in the clerk's office has been accepted and filled. That individual will also be starting on June 16th. We are still in the process of hiring full-time firefighter and the temporary firefighter. We're also, due to a retirement, looking to replace a common laborer position over at the street department in the public works area. So that's personnel update for the month.
All right. Item number
Excuse me a second,
sorry.
Mr. Chair. Can you mention, like with the clerk's or helper in there, any information who the person is, or is that? Would you rather not?
I would rather not,
that's
just
fine.
because they're still currently employed at their.
Yeah. Okay, makes sense. Oh, I'm sorry.
No, that's right.
No,
Should I ask
good
a
question,
question?
thanks.
Anybody have any other questions for Ryan? Right. Thanks, Ryan, for the update.
You bet.
Item number 3, discuss a request from Alderperson Poulos to provide an incentive for employees who opt out or decline coverage under the city's group health insurance plan. So this was actually something brought to me by an employee asking if we would consider an incentive. Other employers in the area do something similar. So I kind of asked Ryan to see if he had any information on that, and what the benefits and pros and cons would be.
Sure. So, since we talked on Thursday, I believe it was, right? It's something that's been kicked around here for the last few years. Different examples of employee opt-out for health insurance. Talked to our broker, actually just today. I talked to them on Friday, and then they were able to send over some information today, just with some options that are out there. And I guess if it's all right, I would just walk you through kind of the 3 more popular options that they're seeing at the moment as the insurance broker. One option is a spousal, and this goes away from a little bit to not necessarily incentivizing employees for the insurance, but rather there would be a surcharge for spousal insurance. So we've seen that anywhere that can go from $50 a month to $400 a month for a spousal surcharge. That is under the caveat that the spouse would have eligible employer-sponsored insurance coverage. You cannot take the government, Badger Care, those types of things, Medicare, Medicaid, none of that applies. Anything government-sponsored does not qualify. Does that make sense so far? Mm-hmm. So the employer spousal surcharge is one option. The other option is cash in lieu of. That's where the employee would receive cash out payments for opting out of the health insurance at the city. Caveat to that, anybody currently not on the health insurance plan has to be offered that same option, okay, for equality purposes, right? So people that have been off the insurance for maybe the last 15 years at just no cost to the city, we would now take on that expense of paying them to remain off the insurance and go on spouses. There are regulatory standards. They do have to show proof that they have actual insurance at another place of employment. They couldn't just say, I'm doing this and we pay them. There are IRS guidelines and governmental guidelines to prove that they are on insurance elsewhere. So that's another option. Kind of a common figure is anywhere from $3,600 a year to $5,000 a year. So $3,600 to $5,000. Those are then typically the practices. Those payments are made quarterly, at each quarter end, because that way you do have employees that could leave or come on, so they either fall off. So anyway, it's prorated. It could be a prorated benefit of that 3,600 or 5,000, whatever the figure is. That equates out to 360 would be, or 3,600 would be how much a month? I should be better at math. But a few hundred, $300 a month, so a couple $100 a month for the employee to stay off the insurance. The other option, well, and it can kind of be twofold, it's called a family savings plan and or a spousal surcharge. That's hard to say after you say it many times. The spousal surcharge and the family savings plan. This is fairly new, but apparently it's really popular now, gaining steam on the eastern side of the state. That would be where, again, spouse has employer-sponsored insurance possibility. If we wanted to surcharge them for staying on our policy, you can. The other option would be they go on that insurance of the other employer. The city then would potentially pay the whole deductible of that individual. Once the deductible's met, the city is then done with their due diligence.
I see, okay, so you're kind of fronting them the deductible.
Yep, you're gonna cover the you're gonna cover the deductible of the employee
Yeah, another.
elsewhere. Then once that is met, then, and it includes co-pays, deductibles, co-insurance. So, but there, again, there are caveats, and she did this afternoon send me an example or how it would lay out and what needs to be, gotta be in the network to be covered for the 100% out of pocket. Need to be in the network with the spouse's insurance, covered service under spouse's insurance. Claims have to be filed within 180 days. It's available to members who've been enrolled on the insurance and transition off the plan. So, again, there's some caveats to it. I haven't, like I said, this came in this afternoon. Didn't become an expert on it, but I did have a good talk with our representative from M3. She did a wonderful job walking me through this, then sent this. She actually, we will start in a couple months for the city of Wisconsin Rapids. Our renewal will be coming up, and we'll be talking about this. And she actually said the timing is, kind of nice, because she was just contacted by their Green Bay office and said, you might want to start bringing this to central Wisconsin because this kind of is gaining some steam. And she said she was going to start running some numbers to see if it would be worth their while, based on the dependents. So when I talk about dependents, it's not necessarily in the sense that we probably think are kids. When insurance is talking about dependents, they're talking about, it could be spouse or children, and there's no deeming of differentiation to our knowledge, obviously with HIPAA and stuff. So.
Mr. Chair,
Yes, go ahead.
maybe you can't answer it if you don't have a whole lot of information, but what advantage is this to the city? I mean,
What advantage would it be? Sure. So the potential, and again, without saying, I'm not saying this is a matter of fact, but here's the perception. Here's how I read it. Right now, we pay approximately $2,000 a month for an employee to have family health plan insurance. That would be $24,000 a year.
right.
Okay, for every family plan. If we offered this plan and their deductible at their new employer was, let's pick a, fair number, 5,000, that's probably getting on the low end nowadays, but $5,000 deductible. We would pay them the $5,000 of the deductible as their costs needed to be met, and then we're done. We're not paying that $24,000. So you're netting $19,000 in quick math. You're netting $19,000 there.
I guess my problem is that, because I know enough people that have quit different jobs and gone somewhere where they've had good benefits, but they went elsewhere, where they would not get the benefits, but their wife was working and that's what they relied on. That's why I'm wondering what advantage this is to the city. If somebody doesn't want, the insurance, then wouldn't that save the city money right there?
I mean, right now it does, but we don't recognize, I mean, if somebody currently works here and they say, no, I'm not taking the insurance, I have my spouse's. Okay, but that just never hits our books financially. Like right now, the purpose, I think, of Justin's, and you tell me if I'm wrong, is there a way to incentivize employees who are currently on the plan, or maybe coming on the plan that are employees of the city currently, that they may go elsewhere and take the insurance, which would be less, then you start seeing some savings on the books. So, for example, the $24,000 plus minus the $5,000 that we would incur, theoretically the city nets at that time $19,000. Now, the downside of the were there more questions? The downside of incentivizing a cash out or cash in lieu of option, and I alluded to it earlier, we already have a number of employees not taking the insurance.
Any idea what that number is?
Not off the top of my head.
100? 50?
No, 20, I'm guessing.
Mhm.
So you have 20 people, for example, that you'd have to catch up, right? So you're already gonna be in if you're gonna pay them $5,000 a piece, 20 times 5,000. Now you just took on that added expense. Now you hopefully find enough other employees to come off the insurance to make up for that 5,000 times 20, right? $100,000 at $5,000 a crack. So you gotta find another 20 just to break even. You gotta find 40 to save 100,000.
Yep.
So
So is there a way of taking a survey? Is that legal or no?
I've done that in the past and it didn't go well because then they got into and not at the city of Wisconsin Rapids. It got into no, I don't like this package, and then you get people saying, but I would do it for this, or I would do it for this. Well, now you do it with 50 people, you've got 50 different plans that they wanna pick from so you're negotiating with a bunch of individuals.
Can't you just say this is the only option?
Yep, and then they basically, what they said at the time was no, then we're not interested. The other problem, and I think this is a bigger picture problem, is if your good risk leaves, right, you pay your good risk people to leave. You pay them to leave the program. But it's your good risk employees that leave and you're still left with your high risk or bad risk, our costs are
You're losing
could go up even more.
Right.
And that's what the broker said to be leery of. And with the pool of approximately 192 individuals, we are taking a gamble. It's a little bit easier to dissect if you're looking at a pool of 50 employees. You can almost pinpoint, I assume this individual, but 190 some. And with the turnover, and that I just wanted to put that out there, that's a risk that we have to take, so.
Did you have something?
Sure. I think that's why a lot of companies or small businesses don't do it. There's so many different variables. I think that it would almost have to be some type of spreadsheet with formulas where you could plug different numbers in and see what the outcome is. I haven't heard of this yet, but it is something that you said local companies are doing.
I know the school district, the Wisconsin Rapids School District has offered this incentive many years.
Yeah.
And the history that I have with it is back when I was a city employee, it was something that I always thought would be a benefit. I saw it as possibly a win-win where the city, like we talked about, could save that $19,000. It would give the employee money to cover their deductible on a different plan if their spouse had insurance. But I get what you're saying is you would have to offer that to everybody that currently doesn't take it. And back then, when this was years years ago when this was once discussed, the city was self-insured. So you talk about taking that good risk out, and you're reducing your numbers, so that means you're reducing the amount of people paying into your pot of money. But now that the city is not self-insured, I thought maybe it was worth revisiting. But I do have and I kind of shied away now from that first option or that second option of giving just the incentive, because you have to give it to everybody that currently doesn't have the insurance. But my question would be, is that family savings plan, this seems like this could be the win-win if does that also have to be offered to everybody that currently doesn't have in the insurance, or is that something?
That's a,
I was gonna.
Yep, go ahead.
Forgot what I meant now, but yeah, so I see, I think that's exactly what would happen would be the low risk people opting out and staying on their spouse's insurance. And then if you're gonna pay the premium anyway, I mean, it could snowball quickly would be the concern. I think it's common right now, I mean, whoever in your relationship has the better insurance, you have to go with them, and then you don't pay a premium is the benefit of that. Not necessarily getting a payout from said company, you just don't pay a premium, which is already a win.
What do you mean you don't get a premium?
If you opt out of your insurance at your job because, you know, say
You don't pay your monthly.
your
fee.
wife.
Oh, well,
Yeah.
you still gotta pay a premium to somebody though.
Just
Right.
the two of them.
Right,
Saving them.
right, that's the incentive. Or if you're two single people right now and you get married, you go to one premium instead of two. That's been the benefit and by default why people do it right now, without any payouts or anything. So I don't know if we would, incentivizing this is really incentivizing taking the payout for more people to go on their spouse's insurance.
It is something that's been around for, I know, 20 plus years. I've worked with it. The credit union, we had it from the time I got there. And actually, that's 25 plus years now. And those were $625 quarterly increments, and that's exactly what the spouses would do. They would take that with what their current rate is, they'd go match it to their spouses and say, yeah, it's gonna be more expensive with my spouses. However, I'm getting paid whatever thousand that would be, cause you pay them for health, dental, you know, to stay off. And they'd say, I'm still coming out ahead, $2,000. So if they did mix and match, but
I can
it's,
The per year, I guess, is what concerns me. I mean, that, so many variables, then the fluctuation and what it costs per year. Potential savings, but I'd be weary of going down this route again unless we were able to really run through what that would look like. Probable, a survey, simple, you know, here would be the option, would you do it or wouldn't you? And then take a look at the finances of, Tim probably would be running that,
Yep.
but take a look at what that would look like so we don't get ourselves in any financial trouble. And then I think of it from the point of, if you are a lower risk, and this is just how insurance works, but you're able to opt out and leave your high-risk coworkers on, then, you know, the organization as a whole, you know, who really, one side benefits, one side doesn't there. So there's a lot of different factors.
there's a ton of factors. And again, like I said, I talked to, you know, we talked on Thursday and started with it on Friday and got this today. At this point in time, I think the one that should probably deserve the most attention would be the family savings plan and spousal surcharge. That combination, that's just from the information I've gathered and from talking to our rep, that seems to be the soundest one if we were to go a different route. And she said, since we're gonna be talking in a couple months anyway, with renewals coming up at the end of the year, that she would have numbers going forward as to what that might look like, and they're good about to your original question, what you said, would it be for everybody?
Yeah.
You either have to be on our insurance for 1 full year, like from start time.
Okay.
So the way I'm reading this, people that aren't taking it now and aren't on it, they would not apply.
Okay.
So it's more of a line in the sand going forward.
Okay, that would help then, as far as you went, open the door up to the 20 plus other people that may be
Right.
on.
Clarification.
Yeah.
You're saying you would not allow them to be a part of the pool that they didn't take the insurance to get their $5,000 or whatever it was?
Right. They can if they, well, they wouldn't get it, right, they would not be offered that option.
Huh.
Yeah,
They would have to come back on the city's insurance for at least 1 year.
at least 1 year. And then at renewal time, then take it.
And that's a legal thing?
Hmm?
Why is that? It's a legal thing?
I'm assuming it's their, I didn't ask her about this, I'm assuming it's because they want, you gotta at least collect 1 year, otherwise you're gonna be looking at a straight loss, potentially right off the bat. If you have everybody bail, you're at least gonna collect X amount, you know, you got employees that aren't on it currently, they get on for a year, okay, now it's renewal time, now if you want, you can get off and we'll pay your deductibles.
Ryan, what, if anything, do employees pay towards their health insurance outside of union? Do you know?
Just over $100, I can look, just over $100 a check for health insurance.
For individual?
Family.
Family.
Individual is less, I'm gonna say 60 some a check. So it's 90-10 is what the split is. And then I think that's the other option to look at is the city provides wonderful benefits. So while, you know, yeah, we might be able to get a couple, but, you know, we kind of pride ourselves on the benefit side, for recruiting and retention. People, no matter what the incentive is, might be like, no, this is still the best around.
True.
But again, it's worth, I think it's worth delving into and having the conversation. And if, actually what I could do is talk to M3, they can put a survey together, I imagine, for us. Because they've run down this road many times.
Do you think 3M would be willing to do M3?
M3,
Yep.
yep.
Would be willing to, I think it's maybe not worth exploring too much of the in cash and lieu option. And really the spousal surcharge, I brought this something in, we could find a way it would be a win-win, a win for the city, a win for the employee. I think spousal charge is a win maybe for the city, but not necessarily for the employee. You're getting penalized because your spouse has, you know, a job that provides, you know, insurance. So I don't know if that's really worth exploring, but I do think the family savings plan, and this is where M3 might be able to give a better prediction on who would take that insurance. I think it might actually be people who might be your higher risk because they're only going to get that savings at $5,000 if they plan on using their insurance. If they don't really plan on using their insurance, it's really not that much of an incentive for
Sure.
them.
Good point.
And they'll stay on the city's insurance paying into it. But if there's somebody, a family that they know they meet their deductible every year, which means it may be costing more than what they're paying into the plan, that might be somebody that says, you know what, I'll go on a different employer's insurance and get my deductible covered that I know that I'm gonna probably meet. So I think there's actually, and they're the experts, they would be able to tell us who likely would utilize that. So.
100%. If you want, it's sounding like it. Do you want me to keep moving forward on getting information and drill down on as much data?
I
Or
believe there's a potential
suggestions
win
and
for
like
the city and win
information.
for the employee, so yeah, I think it's worth at
You're
least that
talking
family
the-
savings plan.
The family saving, okay.
I don't know what the rest of the.
I have just one question. Right now with the health insurance that you offer everybody, what percentage does the city pay versus the employee?
It's a 90-10 split. So the city pays 90%.
That's what I thought it was.
Yep. 50-50 on dental, sorry, let me retract. 90-10 on health insurance,
Right,
50-50
yeah.
on dental. Dental is
bad.
minimal.
I'm just curious if you can ask the question if the cooperatives are a part of that, or if that's out of the,
The cooperatives.
yeah, they're not insurance companies, they're cooperatives.
Yeah.
Where you can
This,
buy,
this is not, this family savings plan, is that the one you're talking about?
yeah, I don't know if that's, like, can you switch off, get paid, and then
To
take
go on
that money
into a co-op.
and put it into a co-op?
That I don't know, that's a good question.
So, we're when you say family savings plan, we're talking about a FSA to go alongside the insurance?
No,
Or
the family
just-
savings plan, they go take the spouse's insurance and we pay their deductible.
Okay.
They're off our insurance. So,
How's that not a win? How's that not a win? You're saying that wasn't a win?
I think it's win.
Okay.
Yeah.
he's saying not a win if we surcharge the spouse.
I didn't catch the surcharge, the spouse one, I
Yeah,
guess.
that was option number one, family savings plan and spousal surcharge. So if they have the option to go on the spouse's plan and they opt not to, you know, they're, essentially it's like, you're being offered this deal, you're not taking it, well then we're gonna ask you to pay a little bit more to continue to be on our health insurance plan. Now, you can just do a straight
Yeah.
family savings plan. That there's nothing, and again, I said earlier, I think I said anywhere from $50 surcharge a month to 400, but I think 400 is too high.
There would have to be a max on that?
On the surcharge,
On the deductible?
whatever,
Because
is
they-
the highest.
They could take the high deductible plan for their company.
Yep.
And then now you're stuck in.
Yeah, it's
20
so
grand.
to pay the maximum under the ACA, so it's
Yeah.
like $8,700 for single and
I think 18,200
For a family.
would be the max. Again, but on a family plan, 24,000 minus 18,200. I mean, now you're splitting, now it's getting down to
Yeah.
peanuts, right? And then this company, this is where M3 kind of steps in. This is where I got confused today on the phone is, this administrator then takes a percentage of your saving, that's how they make the money on this. They take anywhere from 25 to 35% of your savings, so now your $6,000 savings became 4,200 if they took 1,800 of it. But but that was the most this year, was the example she sent me, 18,200 in 2025. But that's only gonna keep going up, so that's a fair question.
But why wouldn't every two-plan family do that? Because they're basically not gonna have any expenses. Like, right now, we've got a well, I don't know how many people, you said it was 20, it could be
Yeah.
20, that are on their spouse's plan. And I know there's the year that you have to be on our plan, but
Yep.
let's say people get on it for the year. But everybody that has a spouse that has a plan and it has a plan here would do the family plan because they get everything paid for. The deductible of the other plan would be completely paid for, they won't have a penny out-of-pocket expenses. So then everybody, let's just say, does that, so we have to pay for everybody.
Their deductibles, yeah. Yeah.
Right.
So yeah, if you took,
Whereas, I mean, I guess you kinda gotta look at the census of how many people are doing it now, well, how many,
right,
but.
I see what
it
you're
just
saying
seems
though, if
like-
we had 80 people jump off at 5,000 apiece, we're paying $400,000 in deductibles, right? Is that what you're saying?
Yeah, well, I just seem like it really is incentivizing.
Yeah.
Yeah, it is.
And then you're gonna have to pay those, but I realize, well, okay, then we don't have to pay the premiums, but.
Yeah.
It's kind of like, well, if then those people wouldn't have done that, and it's all just, doing
Right.
the numbers, I guess, right?
Right,
And
sure.
How are you gonna come out ahead or not, or.
But if it shrinks our pool, isn't it also
I was just gonna say, now doesn't
Yeah.
that cause it to increase
everything to
everybody
go
else?
up?
Yeah.
It's a risk. I mean, that's where it gets to be who's staying on and going off. Your good risk or your bad risk. And unfortunately, that's where we can ask them to drill
Yeah,
down
they would-
for.
I've seen this and implemented this before, so they would have probably good numbers for us to look at.
Yeah. I will say that I know, to my knowledge, our highest claimants so far in quarter 3 have been dependent
based on our previous path with kind of this insurance journey, we just took a bump up, but potential to go back down. And then all these different variables, I mean, where I stand right now is, I think it'd be too risky to take any action, but if there's some benefit to the city in going down one of these routes, which would be the taxpayer, then, you know, it's something to talk about, but.
And I think this, I'm glad you brought it up now, because I assume it would be for a 2026, right?
Oh, right.
And this ties in nicely because M3 just was here to do our first quarter, then this question came up. Now they can get started on it, so I think we'll, as we go through this, you know, nothing will happen now, obviously. But if you want more information to parse through it, look at win-wins or save the city money or best just to stand pat, they're willing to do that for us and lay out the options in more detail, but.
And potentially, I mean, I know these would be ballpark numbers, but there's gotta be like a year 1, year 2, year 3, or how do we, cause then as a city, how do we forecast?
Right.
Going from a model that's been in place forever, there's some variables based on claims.
Yep.
To, we don't know how employees are gonna react to this.
Right, exactly.
And that's gonna have budgetary effects one way or the other, it's not gonna be, you know, break even.
Right.
It's either gonna go one way or the other.
Exactly. I mean, it's a risk or reward type, you know, conversation, but I think if we do our due diligence, you'll be able to make a, between now and, say, October, when the rates are getting narrowed down to what we're looking at, I think that's another factor too, right? Is what are we gonna see for our rate increase, hold, or decrease potentially for 2026? You know, as we get closer and they're getting feelers for how much it's gonna cost.
I mean, you almost have to survey too then who's a single filer versus married filers, right?
We have that information.
You have that
Yeah.
information? Okay.
Yeah.
Cause there's a portion that none of this is even gonna be an option for them, if we're their only insurance offer.
Correct. Yeah. And the single plans don't apply because they're single.
And they have
Or,
to they have to take health insurance.
Just the employee, shouldn't say, so employee only option. They're, you know, they're just their own
Yeah,
entity.
unless they're going to market, they'll be taking the insurance.
Yep.
So can you check too, like, we wouldn't just pay a deductible, we would have to pay their deductible as they were needing it.
Right.
So
Yeah.
then it may not be much of a deductible, or it could be the full deductible.
Could be,
but
right.
We don't know.
That's where I was saying, the claims must be filed within 180 days of the day of service.
Mm.
So they would file the claims, we'd see the claims, yep, it was paid.
Okay.
We're now
So
gonna
it is-
pay, it's a pay.
It's adding another layer of
It's gonna,
complication though to the
Potential.
process, yeah.
yep.
And could you cap that deduct, I mean, even though, let's say they had an $18,000 deductible, can you cap it at, let's say it's 5,000?
I don't believe so. My understanding was, in the language, she said, in the example she set, the most you could have to pay would be the max. So I believe if you're going in, you gotta pay, we couldn't pay them and say, this year we're gonna pay you 5,000. Well, times got a little tighter. Now we're only gonna pay you 4,000. It's whatever their policy is up to the max. So you'd have to max out their policy.
And then the employee's still responsible for paying the premium on that other plan. We wouldn't reimburse them the premium, just the deductible.
Just the deductibles, co-pays, co-insurance. Yep. Out-of-pocket expenses.
Yeah, I don't think it's worth, I don't think we can make a decision without numbers, but I think it's definitely worth, getting some numbers from M3 and seeing what the history is with other cities or other employers that are our size that implemented it and see if it, you know, initially, I really believed it was initially worth pursuing because of the potential it could be a win-win for the city and the employee, so.
Yeah, it's a conversation that's been around a long time. I mean, we haven't casually, and we've talked about, kicked it around here over the last couple of years, but, you know, people who were on position, but I'm not taking the insurance. Can you, I've even had potential new employees say, you can't pay me anymore, and it's like, well, no, that's different, you know, but it's a argument to be made, right? So it's been, and again, it's insurance, so that it's not a clear picture ever, you know, it's this, you're trying to predict the unpredictable, and it gets to be, but again, to M3's credit, I think that's why they're so good at what they do, they're pretty accurate, so, thank you.
Thank you for researching that. Anybody else have anything else on that? Alright, item number 4. The committee may go into closed session under section 19.85, paragraph 1E, under the Wisconsin State Statute, which reads, deliberating or negotiating the purchase of public properties, the investing of public funds, or conducting otherwise specified public business whenever competitive or bargaining reasons require a closed session. In closed session, the committee will be updated and will discuss negotiation and bargaining strategies regarding labor negotiations with the WRPPA and the IAFF. Motion to go into closed session.
Second.
Second. Okay.
Yep, alright, yep.
You made the motion?
Yeah, I'll make the motion, I guess.
Yeah.
Okay, I wasn't,
Jake.
who made the motion here?
Okay. We'll do a roll call vote.
Aye.
Aye.
Dennis? Aye. All in favor? We'll go into closed session